Hello, this is episode 5 for the live Q&As. Um, I will give everyone time to join as usual. The once the live is over, I change the title to sort of narrow down what we talk about, so it can be easier to find. Um, so while we're waiting, let's talk about some of the things that were brought up during the week. Hello, feel free to leave your question whenever you're ready. This is open to everybody. So, a big thing that I got from this past week from the post was the hand shoving. And so I do want to clarify that there is a difference between babies who are mouthing in exploration versus babies who had not been doing that. So anybody any um child older than, I would say, 8 months. At some point, we want them to be using their hands to do things and explore with their hands. So when they start to grab things and they start to explore that way versus having to mouth everything to explore, we see a distance in that mouthing behavior. Um, they may take objects and still mouth them, but as far as shoving their hands in their mouth and sort of sitting there or sucking on them, that is not exploration. That is not like infants when they're exploring and they find their hands, or they take objects and they mouth them, right? That is different. And so when we're looking at the hand in the mouth that's sort of just sitting there or they're sucking on it, then we need to look at why. Um, or the toddler who starts chewing on their shirt. So those are all different things. We have exploration as an infant, which is totally normal. When they start to grab things and bring that to the mouth and they start to explore objects and less of their hands. Once they get more stable in their body and core control, they start to explore with their hands, with their eyes, with touch, right? And they're doing other things, they're expanding that. So if we find that they start shoving and sucking, we want to look at what's going on with their airway space. Are they a little congested? Then let's add some nasal hygiene. Are they teething? Are they using that sucking as a pain reliever? Then let's give them something more appropriate, like a cold. You can stick a teether in the freezer, make it cold. Um, they have those mesh teethers where you can put in frozen fruits, and that is really nice on their teeth if they're teething. Um, I'm gonna not say this right, but copaiba, Copaiba, I think, oil diluted with avocado or coconut oil and rubbing it on their gums can be really beneficial for teething. And so that's if you're thinking that those are things to replace that hand shoving with. Um, Sometimes you like older kids, like I'm talking 3 and 4, when you start to see the shirt chewing, then we're thinking, okay, um, or if they're like gnawing on their finger, are they seeking some sort of input? And by that, I mean that it, sometimes when they're growing, like bones are growing, right? There's lots of growth in the face. Um, just like the body, the bones in the face have to grow. Those muscles need input. They need to move. And so sometimes they could be seeking that input. If you ever like lay down so long and you just feel like you need to get up, like you need to move your muscles and stretch, that's the same idea. And so we need to give that input to those muscles. So your hard veggies, apple slices. If you are in an age range where you don't feel comfortable giving them raw veggies to chew and swallow, so 15 months, 18 months, you can cut them thin, thin, thin so that they can practice that chewing of the raw veggies, and work your way up as they get better and more efficient at it. You can give whole apples with the skin so that they're just sort of shredding it, or take the skin off and have them shred just like the pieces of it. You're sitting right there and watching them. So, you shouldn't leave them at the table with anything raw like that. So steak strips, bones, like anything that they can gnaw on to give the input. So when I say they're oral seeking, I mean that they are wanting some input. Your muscles will seek input sometimes. And so giving them that hard input, those bones to gnaw on, those raw veggies is really, really important. Um, Leave your question. This is open. I am just reviewing the post where I was talking about hand shoving. And so if that was important to you, you can go back and listen to that. But feel free to drop your questions at any point. I thought someone was leaving a question on Instagram. So that is about hand shoving. The last post, and so I kind of linked another post to the hand shoving based off of all the questions, which was hard munching. And so I kind of reviewed what hard munching was. The last post was talking about bottle stability. And that was a pretty easy post, but it's a common thing that I find parents aren't doing. And so when they're bottle feeding, they tend to hold the bottle out here. Super common. And really, if this the further you are away from the base of what you're doing, the less stable it is, right? And so, giving the baby more stability in their feed by just sliding your hand up to the top can really support their control. We're not trying to force and we're not trying to overpower their control. We're trying to support the control that they're seeking. And so, increasing stability can do that. It also frees up some of your fingers to give that gentle side cheek support that we talked about in the last Q&A. If you're wanting to or need to, or you can just tuck your fingers in. So those are the two things that we've talked about over the past week, and sort of questions that I've gotten that I want to put out there. If you have a question, please feel free, or we will call this Q&A to an end. Newborn oral posture is tongue up, but the mouth is still open. Do you still try to close the mouth, or is this hinting at dysfunction? Yeah. So, but do you still try to close the mouth, or is this, but yes to both answers. We want to try to close the mouth, and it is hinting at dysfunction because we don't just want the tongue tip up. We want the whole tongue on that palate space. Okay. Versus, okay. So, and if the jaw is dropped down, yeah, I can do it. I can have my whole tongue on my palate space, but eventually that muscle is being pulled. And so if the mouth is open, either the tongue isn't sitting all the way up, or at some point in the night, the tongue will drop because it's too much pressure being pulled down. And so we do want the lips closed. Why do they have their lips closed? I always find babies who have partial, like their tongue is up, but their mouth is open to be the most interesting. And usually I find that it's one of two things. Either they are low tone in the face. So they floppy? Like, they're, when you grab their face, do you feel the muscle, or are they kind of just like floppy? And I have a post, if you follow me on Instagram, that I can share after this, where I show too that both have an open mouth posture, but one looks floppy and they were considered low tone. Within normal range, there was no medical diagnosis of it, but they were on the lower end. And so if they're floppy, we're going to need to work on strength, and we need to work on awareness, because those muscles just naturally will be that way. You can't fix tone, right? You can strengthen the muscle to counteract tone, but your tone of your muscles are the tone. That's how you were born. You were born that way. So, If you're on the lower end of muscle tone, then we can add strength to those muscles, and that happens with chewing. And so the more baby chews, and the key to chewing is always, I like to show this. My kids always take my stuff. I like to show this because a lot of times I'll say, okay, video your baby like munching. Parents will be like, yeah, they munch all the time. And baby's like this. Okay. That's not munching. What we want munching to be is this. Okay. They're going all the way in the back and they're working this muscle. You see? So if we're here, okay, you see the muscles in the face work more when they're in the back. That's how you're going to increase strength. It's harder on infants because I mean, you can teach them if they're here, you can grab their hand and sort of force it to the back so that they can get further back, start to explore that and really work on those muscles. It's possible and you can definitely do it. It's just harder to get like you're not going to be like, okay, 3 sets of 10, right? On each side, 5 times a day. Like it doesn't work that way. And so you can increase strength that way, but I also encourage to increase their awareness of that lip closure, because sometimes with low tone, it's just low. Their sensory experience can be a little, their input in their sensory system can be a little low, and so increasing some input here. So if you have the taping protocol, I have a kinesio taping protocol, um, and it shows you what to do, but you're not closing the lips shut. You're just taping around the lips in order to increase that input so that the lips know to close. So there's a couple of things we can be looking at. Is it jaw? Is it the lips? um is it that the tongue isn't all the way up and there's some tension in the back of the tongue, because and then that's where your oral play is going to come in. So we need to get in the back underneath of the tongue to get that tension released so that it can lift up to the top. And if it lifts, the jaw should follow. I hope that helps. So there's three things that we need to kind of look at. Is the back of the tongue tight? And you can tell because you slide your finger under, and can you get all the way to the back molar space and sit nicely in between the gum line and the tongue? If you're underneath the tongue and you slide and you run into the tongue and you're not all the way back to the molar space, then that tongue is anchored down. Then we can start doing some oral play in that space. Two, are we looking at a floppy baby? Normal, but we may need to increase some strength, and so more munching and on the sides of the face. Are we looking at like they need more input into the mouth? Then we're going to do taping. You could do all three if you wanted to. But yes, you want the lips closed, because even if the tongue is all the way up on the space, the likelihood of it staying there when the jaw is being pulled down is slim. Did that help? Do you have a follow-up question? Oh, and so a way to determine like the low tone piece too is how does their mouth look during the day? If it's propped open during the day, then maybe we're leaning more towards low tone. Now, in low tone, if the mouth is propped open and the tongue is sitting low during the day, we could just have tension back here anyway. So it could be all three of them. But what came first? Who knows? Was there tension first? I mean, low tone you're born with, so they would have always had that. Did that lead to the increased tension and decreased sensory awareness? I hope that sort of helps break that down better. Okay. Great to know. We do oral play, oral exercises. We had concerns for a posterior tie. So I would focus on, if you have the oral play guide, I would focus on the under you. And I separated it into like a regular under U and a deep U, where I show you how to really make change in the posterior part of the tongue specifically. That's where I would focus on. The other things in the guide, like the lip circles, would be really nice because we do want to increase that input, right? And again, you had concerns for a posterior tie, and a posterior tie and oral tension can match each other perfectly. So just keep that in mind until there's no other tension in the body. Like, does baby keep shoulders to the ears? Are toes curled in? Are thumbs inside of the fists when they're clenched? All of those things look at like how the body's responding. I want to make sure we address tension to really assess whether what the posterior tie is doing, because the symptoms mimic each other I like perfectly. Okay. I hope that helped. I think that's it for today. Yes, we had a session of craniosacral and have already seen improvement. Awesome. Yay. Yeah, I love craniosacral. And so, yeah, if you're seeing improvement, then we're not quite ready for the tongue tie release, right? Because there was obviously tension. All right. Thanks for coming on. If you have more questions as you go along your journey, I'm here every Tuesday. For everyone else who listens later, I'm here every Tuesday at 3 p.m. Central, where you can ask your questions and get answers related to any sort of infant feeding or oral development. You are welcome. If you have any more questions, please feel free to leave them. Earlier in the talk, we talked about hand shoving, hard munching, and then our question that was brought up today um, from a subscriber was open mouth during night. So all of that is talked about, and it will be saved and on YouTube for future listening. I have lots of parent guides and provide virtual one-on-one for anyone who needs that support as well. I'm waiting to see if anyone else has a question they want to drop, and I'll give them a couple minutes because it could take some time to type things out. I hope you all have a wonderful Thanksgiving. And it's not too crazy out there. Just give about 30 more seconds and then I will head out. All right. I will see you guys later. Thanks for coming on.